I really like with these two gentlemen. Mike came from a practice up north where he was doing this. It had just a little bit different approach and take on things. Has been doing this for a while. Both Mike and I, or Dr. Bergom and myself, are very blessed to have such a senior partner that's got so many years under his belt of breast cancer surgery. And so if I have a difficult case, that's the wonderful thing about having partners. I will bounce it off of them, man. I'll hunt them down like a wounded animal, and I'll find them and say, hey man, I got this going on. I'm worried about X, Y, Z. And then Mike will say, you know what, I saw something like this, and then Dr. Aach will say, yeah, I saw about 43 ones like this in the past. And I'm not saying he's archaic or anything, but he'll pull out his old textbooks that are written on stone and show us like how they used to do things, and like, hey, there's some really good tips, really good techniques. And so having partners, it's super nice. And even our older partner, Dr. Clanahan, he's still around, and he'll pull up a chair every once in a while, and you can bounce stuff off of him. And it's really good to have partners to talk to.
Yeah, I would just second what Paul said. I mean, having partners to ask questions is key, and we are always bouncing cases off each other. In fact, Dr. Aach and I have clinic next to each other once a week, and we probably have 3 or 4 cases a week we bounce off each other. So it's been invaluable. In addition, one thing I'd like to mention is that a lot of the patients that we have get presented at a cancer conference. And what that is it's a conference not just with surgeons, but with the whole cancer team. So we have the medical oncologists there, and usually at least a couple of them, and we have the radiation oncologist there, we have the pathologist there, we have the radiologist there. So it is the whole cancer team, in addition to the nurse navigator. We present the patients that we are treating, and I learned more at that conference than anything, and not just about the surgical tricks, but about what all the other players in the team are doing and how they're treating this patient or seeing the problems that they have in their treatment for this patient.
I would say I'm very, very blessed to be surrounded by youthful, brilliant people who are very, very talented. Both Paul and Mike, as they've already mentioned, we're running cases by each other all the time. It's amazing what you can learn from other people. Each surgeon, we're trained differently. We have different experiences, and you end up and you can come up with a way of handling a problem that other people haven't thought of. And the advantage of that is it just keeps adding to what you do every day to increase the way that you can best take care of people. I had a tough case last week, all scrubbed in, and we worked together to complete it resolution. And I think the additive thing, obviously Dr. Clanahan is a genius, been around a long time. He's always around to run things by him that are difficult. And then I think the last point is you have a group, and I'm very blessed with not only these two gentlemen, Dr. Clanahan, but the rest of Lincoln Surgical. They're brilliant, humble, energetic people, and it's very, very refreshing. And I hear this from patients all the time: is you take great care of us, and you're very responsive, but you guys you're kind of normal. We can talk to you, and you treat us very well. And that, unfortunately, is not always the case with working with other physicians who can't communicate well. And the folks here, especially these two gentlemen, the way that they handle people, it's just absolutely amazing.